Joy, do you want to get us started? Are you on mute? Here, I can't see.
Yes, I apologize.
There you go. There you go.
Sorry, I just read the whole script, so I'll do it again. That was so much fun. Thank you, Meredith, and our Wentworth students for organizing that. We want this week to be as interactive as possible, so I hope you guys enjoyed that. We would also like to continue to thank our corporate sponsors, Corporate Care, 4 Point Project Partners, Margulies Peruzzi, Timberline Construction, and VVA Project and Construction Managers for underwriting this year's conference. We will have a breakout session today, and it will be led by moderators that's in the room. If you find yourself in a room without a moderator, please just either volunteer or select somebody. After this session, like this morning, we will continue the conversation with our FM members and our speakers. If you are an FM and you received the private invite, please join us after in the FM community link. And if you don't have the link, feel free to email Janessa or myself during the session and we will send it right out to you. So without further ado, let's get started. I will introduce you to today's speakers, Jason Jones, Director of Workplace Services and Planning at AstraZeneca, and Kim Giles, Senior Project Director at MovePlan. You can see their full bios in the swag box. Take it away, Kim and Jason.
Thank you, Joy. And thank you for everybody coming to our conversation today. I appreciate the intro. Again, my name is Kim Giles. I'm from MovePlan. I am going to be moderating our discussion today with Jason and one of our colleagues, Mayee Tang. Just a little bit again about ourselves. Jason, as you heard, is our Director of Workplace Services and Planning for AstraZeneca. He's been in industry for almost 19 years, Jason, and 7 years with AstraZeneca, including some of their legacy teams from MedImmune and the biologics division of AstraZeneca. I'm also joined by Mayee Tang. She is our Senior Occupancy and Workplace Strategy Manager at AstraZeneca, happens to be a MovePlan team member as well. And Mayee's been in industry for about 17 years, working in occupancy and workplace planning, and almost 6 years next month, right, Mayee, with AstraZeneca supporting their occupancy and workplace and facilities teams. And then, of course, myself, leading the U.S. East Division here with MovePlan, sorry, and working with the team here at AstraZeneca for a little over 5 years as well. So today, our learning objectives are going to be talking through AstraZeneca's transition between a variety of different corporate projects that they had going on prior to the pandemic. And we'll talk about the impact on those projects with the pandemic upon us. So our story today is to really talk about where they were prior to COVID-19. AstraZeneca's global real estate team and site operations team had a vision back in 2019 to actually unify their campus and bring a variety of legacy businesses under one roof. And so with that, they created some programs and projects that had creativity and collaboration and sustainability in mind, and had decided to actually embark on this project in 2019. Our discussion today, we're going to jump in and talk through how AstraZeneca was able to pivot some of those projects and modify their strategy amidst the pandemic while ensuring the continuity and forward progress of their R&D business, which, as you can assume, was pretty essential. And we'll hear from Jason and Mayee about the impacts of the pandemic on that project that they embarked upon in 2019. And you'll hear us talk about that project called One Campus throughout the course of the conversations today. We've asked Jason and Mayee to step in and give us some of their highlights on that project, talk through some of the concerns and challenges that they faced, ensuring that critical business continued. We will talk a little bit about the change management program that the One Campus project had included in it and how that had to pivot and change in the pandemic. And we'll obviously focus on the importance of remaining agile during this whole process. So with no further ado, I'd like to introduce you to Jason and have Jason step in and talk about where they were with some planning. Jason.
Great, thanks, Kim. Appreciate the introduction and good afternoon, everyone. It's a pleasure to be here today. As Kim mentioned, I'm Jason Jones. I am the Director of Workplace Services and Planning, and I just wanted to share a bit about our real estate strategy and journey to help us plan for the future. So next slide, Nicole. So the Gaithersburg campus is AstraZeneca's largest R&D site in North America, and it's comprised of 10 buildings on campus. Essentially, there are 9 buildings of which our colleagues are working in, and then we have an on-site daycare as well. 3 of the buildings are owned and make up our core campus. That would be the 2 in the yellow and red, and this graphic is kind of giving a dashboard view with respect to our occupancy of where we have capacity in green, where we had limited capacity in yellow, and in red where we were nearing excuse me 100% capacity. So as Kim had alluded to, in 2019, AstraZeneca made some announcements and organizational changes to really align the different business and research and development units within the organization to take some of the legacy mergers and acquisitions and bring them under to a different operating model or a different umbrella. And as a result of that, the Gaithersburg campus, being the largest R&D site, then was forecasting a significant amount of growth. And if you can see in the chart up above, from our end of 2019 number, we were reaching near capacity at the end of 2020 and growing well beyond it in 2023. In fact, our site was scheduled to grow from around 3,400 colleagues between another 800 and 1,000 roles over a 3-year period. And so given that, we needed to make some decisions as to how we're going to plan for the future. So we used several data elements to develop scenarios to help inform decisions amongst the alternatives. And once a decision was made, it was important to share those elements. Being a scientific organization and our environment and culture is that we challenge the status quo. We don't necessarily take things for face value, and so we really needed to take a data-driven approach in order to determine and recommend the appropriate next steps. So with that, I'd like to introduce you to Mayee Tang. Mayee is going to share a bit about the data elements that we collected and how we started to gather information to help inform our decisions. Mayee?
Thanks, Jason. Good afternoon, everyone. I am Mayee Tang, and it's great to be here today to share our story. So after starting at AstraZeneca and helping to manage and develop their long-range occupancy planning program and strategies, I quickly learned that we weren't necessarily optimizing our real estate portfolio as efficiently as we possibly could, just through routine walks and working in the actual space. So coupled with the headcount projections that were being forecasted for the organization, we knew that it was time to make some moves. Being in the industry and working in facilities, I'm sure we've all heard the longstanding story of, we're always here in the office and we don't have enough seats. Well, AstraZeneca is no exception to that rule, and that we knew that we had to prove to our scientists, who are data-driven by nature, as Jason pointed out, and so that we were well positioned to make a change to our workplace strategy. So we started looking at what they actually do by collecting badge swipe data, which provided a high-level overview of how often employees were actually coming to site, which we then dissected by functional team and presented to each of the individual business groups. What we found was that the majority of the teams were not coming to site as often as they thought, which was no surprise to us in site operations, of course. But it was interesting to see that more than half of the population didn't even meet our seating criteria minimum of roughly 60% of the time on site in order to be assigned a seat on campus. But of course, the teams were taken back by their data and in disbelief. So next, we decided to engage employees by asking them what they thought and conducted a Leesman survey. So for those of you who are unfamiliar with Leesman, they were established around 2010, and Leesman is a leader in measuring workplace effectiveness. What they use this index called Leesman Index as a global benchmark that captures employees' feedback on how well the workplace environment supports their ways of working and their daily activities. What we were able to glean from the results of that survey was that employees believe that they spent approximately 70% of their time in an individual space, which was primarily at their workstations, which did not align with the badge swipe data that we had collected, nor did it match what we saw on a typical day just walking through our buildings. So with that, we decided to close the loop and validate our suspicions and assumptions against those Leesman results by conducting utilization studies of our spaces to see what they actually did. These studies consisted of a two-week physical walkthrough of each of our spaces, either 4 or 5 times a day, to record utilization counts, to record the activities that was happening in each of the spaces and what they were being used for. What our findings informed us was that, in fact, while employees felt that they spent 70% of the time in their seats, in reality, employees were really using their seats only 30% of the time, because they spent most of their day in other spaces, such as conference rooms or breakout spaces, for meetings and collaboration. So that data just reinforced that we were well positioned to potentially move to a new way of working and optimize our existing footprint better. So after taking a holistic view by collecting and analyzing 3 different data points, we had the beginnings of a business case to develop a strategy for the campus moving forward in order to address the capacity limitations that we were facing.
Thanks, Mayee. And that's a great summary of the actions that we took. I mean, in order for us to explore the alternatives, we wanted to make sure that we were really using data to help inform that. And so, we observed how often people were going to be on campus. We, by reporting on badge data, we asked people, what do you do throughout the course of the day? Where do you spend your time? And how well does our environment as it's built today support you in being effective? So that was the survey piece of things. So what do they think and feel? And then, as Mayee mentioned, we conducted multiple observational surveys where we walked around and observed, what spaces are being used, how often, and what activities are going on within those spaces when they're being utilized. So next slide, Nicole. So with that being said, we had gathered data and were forced with some decisions to make. And really the 3 things that we looked about were either to build and lease additional space, or rather buy and lease additional space, build an extension on our existing buildings, or to revisit our existing footprint and see if there was opportunity to optimize them. And each of these considerations come with, a different factors to help, kind of score the right next steps. Certainly all of them came with a cost element, the efficiency that they would be able to deliver, not only from a space standpoint, but the efficiency around collaboration and sustainability. We also needed to look at, how quickly can we find an alternative or determine which alternative is the best to meet our needs. And if we are going to look at leasing, for instance, is there something that is available that that it meets our timeframes and is in close proximity? You may have observed from the one of the earlier slides, or the last slide, we showed an overview of our campus. So our campus was consisted of 3 buildings that are owned and 6 buildings that are leased. 3 of which are just a short, 10-minute walk from the main core buildings, and then 3 buildings, 2 of which are research labs that are about 3 miles down the road, so a 10 or 15-minute drive. And underpinned by all of this were some guiding principles around equity and experience on our campus. So equity in terms of the community while you're on campus, as well as, how we're mindful of the community that we're operating in. Fostering a collaboration, not only from using technology, but how are people easy to cross paths and to share ideas and information, which really helps us get medicines to patients as quickly as possible. Creativity, focusing on the creativity aspects of things. Science is creative in nature. Connectivity from a technology standpoint, so leveraging the best technology to help people efficiently go about their day and to share thoughts and ideas and collaborate, and also connectivity within the space. I mean, we wanted to create more of a one feel look of our campus, acknowledging that there were different entities within the AstraZeneca portfolio that were brought together. And as we're forecasting the growth to plan for the future, we wanted to bring that connectivity to our campus environment. And then finally, taking a sustainable mindset in terms of, what is the impact on the environment based on the alternatives that we are looking to consider. So with that, I
Yeah, that's
think
a lot to think about, Jason, right?
absolutely.
Yeah. So I think what we would like to do at this point is actually break you out into a few groups. And we have a question that we would like for you to answer. And Janessa, I'll ask for your support in getting the breakout rooms set up. But the question we would like you to answer is, what would you have done in this situation if in your organization you were faced with this challenge of growing demand on space, the perception that you're out of space? Do you decide to go ahead and acquire new space by adding a new building or adding on to an existing building? Do you lease another building and just accommodate for that demand? Or do you take the route of renovating some existing spaces and look inward and utilize the space that you have a bit more efficiently? So I would ask that in the breakout sessions, you go through and answer that question amongst yourselves, come back with and nominate a captain, if you will, and just throw your answers in the chat, and we'll take a look at what you all would have done in this situation. I think Janessa will have maybe just 5 minutes.
Great. I will. There you go. I'm just going to press record, and everyone should be back.
Welcome back, everybody. I hope you found the time to connect with some new people and have a good discussion about the question that we asked. And as a reminder, the question was, if you were in the situation that AstraZeneca was in, with increasing demand in their space and a lack of capacity and availability in their buildings, what would you do? The question options were, would you build another building? Would you go ahead and lease another building? Or would you look inward and actually renovate existing spaces? So we did ask if you could throw your answers from your team into the chat. We'll just take a minute to see how you all, what you all thought of. So I'll wait for the chats to pop on in. Room 9 said they'd do a mix of all of it. That makes things easier. Thanks, Room 9. All right, we have a couple use the existing first. We have a couple who are saying renovate. Consensus was to evaluate existing actual occupancy. Another group said that they would potentially lease new space. Another group said they were looking to go look inward and maybe do some renovation work. So it's a little all over the place, but I think, Jason, the results seem to be swinging towards looking inward and looking to make the best use of existing space. So with that in mind, why don't you go ahead and tell us the rest of your story? What was the decision or what were some of the pros and cons for your analysis of how to move forward?
Great, thanks, Kim. So, it really was a bit of a mixed bag in terms of preferences of, colleagues on campus as well as our senior leadership teams as to what was the best solution to look at. I mean, in terms of working towards bringing our campus together, building an extension onto our existing largest building, which is comprised of office and research space workers or lab-based workers, seemed to be a great solution in terms of accomplishing that goal. But from a process standpoint and a time and budget, it was the most costly of the alternatives and also the longest time to get the results. While we had a site master plan that was approved, doing the actual design and going through all the geological efforts and things of that nature to get the approvals and be shovel ready and then actually build, construct, and move in, it's just not something that we thought we would be able to accomplish from the get-go. Similarly, looking at space down the road and leasing additional space, proximity and availability of spaces that would be move-in ready within less than a year's time were also key aspects that we considered when we looked at alternatives. And then similarly, looking inside our space, and as many of the breakout groups had referenced, looking at data and metrics and seeing if our existing space could be leveraged as a first pass was another alternative that we considered, both doing, a sort of partial renovation or looking at buildings in holistically and doing complete renovations. So Mayee's going to share a little bit more about what we decided to do and what were the drivers that helped led to that decision.
Thanks, Jason. So ultimately, we decided to make use of our existing real estate and retrofit our spaces. What did that look like for us exactly? We knew that we needed to create the capacity for the anticipated growth, but we needed to spend the dollars in the right place. And so we had fairly recently completed renovations of our own buildings so that the spaces already looked nice, and we were already operating in an open plan environment. The furniture was current, it was a great place to work, but what we realized it lacked was a variety of different spaces where people could get together for small sessions or impromptu meetings. And so based on the data that we collected, we knew that we would be able to better align to the global workplace strategy that both our physical space and our employee behavior supported, to move to unallocated seating, taking activity-based design one step further. So what we wanted to do, we set out to accomplish, to create neighborhoods and co-locate teams to build a collaborative environment that wasn't segmented by where you sat, to provide choice, variety, and flexibility in seating options by adding new exciting alternative furniture to our spaces to foster that community mindset without necessarily, being behind closed doors for a conventional meeting. It was important that employees had the opportunities to select the right space for the right activity at the right time. So this change to unallocated seating and the culture shift to a more equitable campus was the birth of our One Campus initiative. And so Kim is now going to talk us through the development of our much needed, robust change management program to guide us through this journey. Kim, you're on mute.
Thank you. Thanks, Mayee. So as Mayee mentioned, the biggest shift in cultural components was the shift to unassigned or unallocated seating. And so with the One Campus program, a robust change management program needed to be created. So our team with MovePlan worked very closely with the internal communications team and change management teams to understand the best way of communicating those changes to the impacted staff, and how to get everybody accustomed to this new way of working, as it was definitely very different from how the groups had worked previously. As you heard with the data, there was a perception that folks were coming in 70% of the time, when in fact they were not at a seat more than 30% of the time. And so there was a big disconnect that we needed to make sure that we addressed within the change management program. So we embarked on this lovely change management program, and then we all came to a point in the spring of last year where the pandemic impacted the program. And so at this point, we needed to make a shift. I'm going to actually pause here for a moment, because in this element, we're going to talk a little bit about the polling question on a whiteboard paddle. So everybody have that?
While you're getting your whiteboard paddle out, I'd just like to add that, we made a decision, and we made a decision to move to unallocated seating by adding more choice and variety and flexibility into our ways of working. And that, again, was really driven by, people told us that they were spending 70 to 75% of their day in one or two locations. But what we observed was just over 30%. And so we were able to realize that there's the opportunity to make better use of the desking areas in an unallocated way by, removing the name tag that Jason's name is on that desk, but he's spending most of his times in meetings throughout the day, and add, additional flexibility within the environment to help enable people to be where they need to be when they need to be there. So we made a decision. We communicated it in mid to end of March to our campus that we had made a decision, we're going to be moving in this direction, and then COVID happened. So given that, we wanted to ask this polling question of, once the pandemic happened, if you were in this situation, what would you do? Would you continue the renovations? Would you put the renovations on hold? Or would you stop completely and wait until the pandemic was done?
Yes, so exactly. I jumped the gun a little bit, but here's the paddle. So if everyone has one of these that you believe you received in your swag box, we would ask you to pull that out. We're going to actually pull the presentation down for a moment so we can actually see your paddles, and to ask the question, would you continue with the reservations? Yes, no, or unsure. Go ahead and write that up and hang it up. Yeah, we have a lot of yeses. There's a few on holds. Awesome. It looks like everyone, it was in agreement that they would move forward, Jason, with the program.
So great. Thank you for your insights. I mean, what we did actually was all of the above. We paused momentarily because we needed to focus on continuing our core business, which is research and development. There was a lot of lab-based work that was actively underway, as the pandemic sort of arrived on our doorstep, and we needed to make sure that we could continue operations so that those years and years of science would not be lost. So we paused temporarily. We actually, in our One Campus initiative, had two buildings which were planned as phase one of it. And we had a third building that, as we alluded to and Mayee touched upon earlier, that we were looking to do a full gut renovation of another of the third owned building that we had on campus. So not something that was going to happen immediately, at least in March when we made the decision. But then we thought, this is an opportunity. Potentially we'll look to fast track that program, and all of that within the guiding principles is that, safety is the first priority. Safety of our colleagues who needed to be on campus, and then being able to maintain business operations and the scientific pipeline while we were, kind of figuring out with everyone else how the pandemic was going to influence the next, few weeks. That's what we thought at first, and then it was a few months, and then, we're a year later now. So definitely an interesting endeavor. So we're going to talk to you a bit more about some of the actions that followed, and we've done quite a bit of talking so far. Sometimes showing you actually is a better solution than talking through, so you can actually envision some of the activities that we did. So we're going to do that a bit next. But before we go to that, one of the things that we were able to accomplish by pausing, focusing on the science and continued operations, but then morphing our change management strategy was to approach things in a different way. And I think that's one of the key takeaways for us, is that once we made the decision, we looked to MovePlan as an expert in this industry to help us define our change management strategy. And we had that in place for the beginning of March, and then everything changed with the pandemic. And so, we needed to respond, be iterative, and to really focus on, how we would move through this effort. So with that, we focused on some priorities during COVID-19, ensuring the safety of our employees. So how do we maintain our business critical operations? What protocols do we need in place to put in place to create a safe environment? How do we communicate to people who are working on site and off site to make sure that they understand what they need to do if they are here, how we're minimizing the risk of exposure, and how they can continue to be connected and deliver if they're working remote? And then how did COVID-19 impact our ability to move to unallocated seating? The employees had some concerns around sharing desks, and this was all occurring at a time which we didn't have much information on, how the virus was spread. So that certainly became, paramount in terms of the talking points. We needed to focus on procurement of supplies. Cleaning supplies, lab supplies to be able to continue the business, some of which were in short supply, as well as PPE for people who needed to be on site and to be able to continue to work. And then one of the other things that we needed to really focus on is, as we developed a phased plan, we essentially, when the stay-at-home order was issued, we went from 6 buildings being open on campus to 3 buildings, our 3 core science buildings. But as the situation began to evolve and I guess initially start to demonstrate a little bit of improvement, we took a few decisions. One is that one of the owned buildings, like I had mentioned, we decided to fast track the renovation of that because it was already vacant. So we completely worked to decommission the building and get it ready for renovations. And then we pivoted and made it a decision to actually increase the capacity on campus and to pause that effort. So Mayee's going to talk a little bit about how we determined essential capacity and physical distance capacity in order to keep the business moving.
Thanks, Jason. So it was critical to determine an approach on how business groups would return to work and when. Based on the local guidances, there were lots of juggling pieces to maneuver. So we had to prioritize who could be invited back to campus based on the availability and readiness of the space. We'll talk a little bit about the solutions and what we had to do to prepare for this return to campus plan, but we also needed to look at how teams needed to work when they were on site. And so the numbers were pretty typical throughout, I think, the nation. We looked at a roughly 30% capacity for our 1.4 million square foot of real estate.
Yep, and all of that, again, maintaining our focus on business critical work. R&D or science is the foundation of the work product. Specifically in Gaithersburg being the one of the only sites in the AstraZeneca portfolio that has the entire drug discovery process from idea to research development to clinical trials through the FDA approval and the commercial commercialization of getting the medicines into the hands of patients and practitioners, as well as a patient advocacy team that helped to remove barriers to medicine. So we had the whole process here on campus, some of which could be done remotely, but we needed to continue to keep the business running in the near term, but also continue future planning. The great news for us is that we were forecasted to continue to grow between 800 and 1,000 roles, and so we couldn't really essentially take our eye off the prize. So next slide.
Yeah, I think, Jason, just to wrap that all back up, to the change management program, as you can imagine, there was a whole lot of different planning that needed to happen through that change management process. So as Jason said, we put pause on that, changed the change management program to focus where it needed to be, which was some of that critical work that needed to continue happening. And so I think where we are right now is, at a point where we can show you a quick little video here. And it should be just about 3 minutes that we prepared for what the look and feel was for some of our team members and colleagues on site. And so with that, I'll just ask Nicole to go ahead and press play. was a great video. Thank you to the AstraZeneca team for putting that together. I think at this point, Jason, can we talk a bit about the solutions and how you guys move forward? We have about 15 minutes left in our presentation. So if we could focus on some solutions and the lessons that you guys learned along the way by continuing this project through a pandemic.
Absolutely. So the pandemic really required us to refocus on, what was important, creating a safe environment, um, putting our patients first, and really being, agile and working towards solutions. So we have some things listed here. It's not, all encompassing and in no particular order, but, our primary objective was to keep the critical work happening. And so, we kept our core research, 3 of the 10 buildings open on campus from March until May, which allowed the scientists to continue to do their work. And then we developed a structured packing and pickup process for all of the 4,000 workstations across campus to be able to allow us to implement an interim unallocated way of working and enhanced cleaning protocols, because not everyone was able to be on campus, and we needed to implement physical distancing protocols in place. So essentially, we packed up all of the contents of all the vertical and horizontal surfaces of the 4,000 desks across campus. Some were packed by employees. At one point, we were giving employees the option to determine whether or not they wanted to come in and pack up their own belongings. And in the end, we decided that, safer at home was really a strategy that we needed to employ, and only have the critical or essential employees on work or on campus delivering work. And so we ended up packing on behalf of colleagues, which made it easier for them, and arranged for contactless pickup so that they could just let us know, drive up and pick up any of their items. And in the end, that it really helped our construction timeline. We were scheduled to begin the project in April of 2020 and complete in June of 2021. And because of us packing on behalf of people and reducing some of the time of where we would normally have employees do that, we started 2 months late and are finishing 2 months early. So starting in June of 2020 and completing the end of April, so next month. And we're really grateful we were able to do that. I mean, a big aspect was really communication with employees throughout several town halls and pre-packing meetings, explaining to them, what we were going to do, what we were, why we were doing it, and it was really all a part of our change management program and journey. The change management was originally around moving towards unallocated seating. Then it pivoted and focused on how are we creating a safe work environment while continuing the capital improvements or the renovations that we were doing. And as we finish those renovations and until physical distancing is no longer required, we're still working in sort of a COVID way. And so we have not yet been able to implement our intended change management of getting the best out of the enhancements that we've made to the space through this renovation program. And so our change strategy that MovePlan has helped us with, will continue to morph throughout this time. Certainly the video featured some of the health and safety protocols that we put in place. So we worked with procurement and vendor partners to fulfill our short-term and long-term PPE and cleaning needs. We installed contactless body temperature scanners and mask stations at the entrances that were open. We provided masks and wipes and hand sanitizers in all of common areas, including all of the 800 team rooms, quiet rooms, and conference rooms we have across campus. We increased the frequency of cleanings of vertical and horizontal surfaces in a lot of areas, and also introduced on-site and drive-through COVID PCR testing, as well as antibody testing. So the PCR testing was for all of our employees and contractors. And business partners. And then the antibody testing was available to employees, for specific sort of benefit reasons. And, initially from procuring supply standpoint, we needed to take what we could get. I think everyone was probably in that boat. But as time went on, we really strived to find sustainable options of how we could, introduce compostable towels and spray as opposed to wipes that were going into the waste stream. And then through all this, employee communication was paramount. Not only creating a safe environment, but communicating what we had done, what was available to people, what was expected of them, and how providing a plethora of channels to share information with employees, but also solicit feedback about what they needed to know, what was working, what we could focus on improvement as sort of an iterative process. And all of that, we were able to continue to focus our plan for the future and to prepare for the growth that was forecasted in Gaithersburg. So Mayee's going to talk a little bit more about some of the return to campus activities.
Thanks, Jason. So before we were ready to invite employees back to campus safely, it took about 3 months to get everything in place for a proper phased return to campus rollout. We started off by reducing the seating capacity at all the buildings in accordance to the local physical distancing guidelines to be able to control the population, which included light closure of the non-critical buildings, as Jason had mentioned previously. We looked at modifying the space by removing approximately every third workstation, um, as well as conference room seating to meet that 6-foot physical distancing requirement. Looked at all of our ancillary furniture and lounges and transitional seating areas as well. We transitioned from one-to-one seating assignments to team-based seating in an unallocated way for the interim. And we work closely with each of the business groups to decide what sort of rotational schedule would work best for their teams. Looking at from a technology perspective, we wanted to standardize all of the technology at each workstation so that a desk is a desk, and you could go up to any desk at any available desk and be able to plug in to dual monitors and a universal docking station without any issue to ensure equal functionality for all on-site employees. We also decided to implement a seating reservation system through our IWMS for staff to be able to book space as well as gather data on utilization. And monitor how often people are actually using the space as well. So we decided it took about 3 months, open buildings by phase starting in July of 2020 with subsequent building openings with increasing capacity in August and again in September. And so to ensure transparency and a smooth transmittal of communication, as Jason has said, was paramount throughout this entire process. We also designated and engaged business function leaders to oversee phase planning activities throughout the entire process to best fit their team's needs and work styles. And we wanted to make sure that they felt that they were heard. So with that, Kim is going to speak a little bit about the importance of employee communications throughout the change management process.
Thanks, Mayee. And in the interest of time, I think we've talked a little bit about the expectations that the AstraZeneca. No need to go back to the video, but thank you. We definitely did play a very integral role in helping to deliver, create, and implement the change management and communication strategies. And I think we've talked a bit about that and weaved it in through Jason's comments. I think what is of interest to, I think maybe this audience is Jason and me through that change management process, that renovation process, the decision to move forward and accelerate some of your work. What were some of the lessons learned as an outcome of moving forward in that direction?
So sure, I'll start. I mean, certainly there was a time savings, like I touched upon earlier. We were able to shave, nearly 4 months off of our original schedule, which was pretty impressive in reference to the amount of packing and pickups and things that we needed to do to even be able to clean our space successfully and efficiently. But this minimized employee downtime, and we know that moving for people is a stressful experience, whether it's at work or away from campus and at home, and then you add a pandemic on top of that. And so we were really able to minimize employees' downtime and to do a lot of that heavy lifting on their behalf. And like I mentioned, our project was a 13-phase project. We are starting phase 12 of it on or phase 13 rather, on Monday. So we're near the finish line and really excited to be able to see, you know, it being completed and to be able to look to the future and implement our new organizational neighborhood assignments. Productivity has been able to be maintained with a large percent of the work of our workers being on site, but also working from home and having that rota system that May reference to that helped us manage our capacity so that we can keep, our physical distancing protocols, but enable people to be on campus when they need to. And AstraZeneca has focused our R&D efforts on developing a vaccine for COVID-19 as well. Originally, when we moved to unallocated seating, there were concerns about cleanliness and safety and different people using desks. And now I think that's kind of an unintended gift from COVID, is that people understand the importance of having a clean desk policy and being able to clean things throughout the day and the end of the day. And we think that that will help our change strategy as we look to the future. And then, by having less people on campus, we were able to fast track our renovations and complete them faster with less disruption. So from, a return standpoint, a lot of people are asking, well, what is our strategy going to be like in the future? And will people, return to work post-pandemic in the way that they're working today? And the jury is still out on that. I mean, it's still early days for us to determine what that's going to look like, but certainly engaging our employees through surveys, as well as working with senior leaders and representatives of each of the business units to help understand that. So May, would you like to add any of the other lessons learned?
Sure. So I think underpinning all of the key lessons learned, flexibility really um, is key here, and it really doesn't have a one size fits all solution. Even though we were able to give them the ability to use booking tools, some teams opted not to do that, and we wanted to help them give or provide the option to help, whatever suited their needs the most, even if that meant that it was a simple spreadsheet that they filled out and sent back. But since we knew that we had apportioned the neighborhoods based on the maximum available seats, we on any given day, we weren't concerned about hitting that capacity. And so even the best laid plans, as we all know, don't necessarily work out the way that we want. And so I think being able to adapt and being agile and pivoting, even though we opened buildings in a methodical way, COVID did get worse, and we still don't know what that will look like. And we were just able to adapt and shift. And I think that's just something that we should all keep in mind.
Thank you.
Mhm.
So it looks like we're at the top of our hour. We had one additional item to share with you all, which was a poll. And we would love for you to go ahead and answer this question. What did you think the AstraZeneca team did best? You've heard a lot of detail around the planning and the reimagining of a project that was in flight as the pandemic hit. But what would you have done? Would you maybe have done something differently? What do you think the AstraZeneca team did well in their planning process? And the results are coming in on the screen.
Thanks,
And
Kim. It would have been nice if we had, a playbook to refer to when this all came about, but there weren't necessarily any guide rules to follow holistically. So it's been a fun journey, and honestly, it's been interesting to see how our colleagues have responded to the space when they've come back and seen the transformation and all the safety protocols that we've implemented.
Yeah, it looks like the results here on the poll, I don't know if everyone else is seeing them on screen, but it seems that everyone seems to feel that you guys did really well at maintaining the business critical functions throughout the need to pivot on the pandemic. So good stuff. Well, thank you, Jason and Mayee. I really appreciate the conversation back and forth. I know that we could have spent another hour talking about some of these, and a lot of us are pretty passionate about them, but I do think we have some additional time to talk through some Q&A in the additional breakout session. And I think, Janessa, that invite was sent out to those who...
The FMs, yes. So Joy will take it from here, but yes, all the FMs, you're welcome to continue the conversation in our FM overtime, and you have that link. And if you don't, you could just check with me.
Thanks, Janessa. That was great. Thank you, Kim, Jason, and Mayee. That was wonderful. We are thrilled today with the level of content that we've had this week and for the rest of the week from all of our powerful speakers. As Janessa just said, for our FMs, you're welcome to join us with the team for a FM overtime discussion. And if you need the link, please email she or I. And if anyone has any additional questions for the speakers that weren't invited to the overtime because you're not an FM, you can add them to the community in their thread for their talk, and you can find it through the topic for the questions. We'll hopefully see everybody at 3:45 this afternoon for another fun daily diversion with Meredith. And that will lead into our last talk of the day with Liberty Mutual. So see you there.
Thanks, everyone.
Thank
Bye,
you.
everybody.
Thank you.
Bye.
Bye.